because because it provides us with evidence, and that evidence will help us in terms of the RISDP and programming, etc. So it provides us with a whole range of indicators and the state of gender in the SADC region, and linked, of course, to the SADC Protocol on Gender and Development. So I'm going to do a presentation on the findings of the barometer for last year. We're in the process of actually producing this year's barometer, which will be launched in August. But for today, I'm going to focus, it doesn't change very much in a year. So I will do a quick presentation, then we can have a discussion about what it means for the outputs and outcomes of the RISDP. Is that okay with everyone? No.
Yes, thank you.
Zoom is just being slightly temperamental about sharing. We'll get there. Genderlinks believes that it's very important to do any kind of presentation, any kind of programming based on evidence. That's how we try and do all of our work. So the production of this barometer is always, a checkpoint. How well are we doing? What should we focus on moving forward, etc. So last year, we launched this barometer virtually due to COVID. I'm sure you've all been there. And I see we've got people coming in. That's great. And really what it is saying, what does the future hold for the next generation of young women? Now, and the barometer happened in the time of COVID. So we had to consider what was that. So we had, a team working on it. We had lots of humans across the region contributing to the barometer. And that's just a picture of all the people who actually helped make the barometer happen. The barometer started off as a barometer of indicators for the whole SADC protocol on gender and development. And what happened is evolved into a particular focus on SRHR. And the reason for that was the RISDP, the previous RISDP had a very strong focus on wellness. And our understanding of wellness starts with, first and foremost, with having control and choices about your own body. So we moved the focus from just the protocol and all the different areas to look at SRHR in its entirety. So what did we do? We produced chapters on health, on adolescent SRHR, safe abortion, HIV and AIDS, gender-based violence, harmful practices, sexual diversity, economic justice, climate change, women's political participation, and gender in the media. And I'll explain how that all works shortly. So we also produce something called the State of Women, where we look at a set of indicators to say what are we measuring and where we are in relation to those indicators. And these are all taken from the protocol, the SADC Protocol on Gender and Development. Now, this slide is very telling. At the same time, and this is where things fall apart a little bit, and I think as non-state actors, very important for us to keep in mind that things work, there are many parallel processes in SADC and at the secretariat level, and they don't always speak to each other. So while all of this was happening, the SADC adopted an SRHR strategy in late 2019, where they have 12 indicators that they measuring countries by. And they include maternal mortality. Actually, it's 20 indicators, but there were only 12 that we felt could be measured. The other 8 were very sort of nebulous. I'm trying to go through this very quickly so that we can have enough time to have a discussion. So there are far too many reds in this, as you can see, which means we're nowhere near. And it's unfortunate that some of those reds are things that we should have resolved that make no sense. So, for example, maternal mortality. In 2020, 2021, women should not be dying in childbirth. Um, Similarly, gender based violence, massive area, proportion of ever partnered women who have been raped by an intimate partner. So it's a very concerning mapping, of where we are as a region. And Shami, we need to share this presentation after. So where are we doing very well in SADC? We're doing very well in HIV and the transmission of HIV. Um, we're doing relatively well around, you know, services, contraception. Not great, but at least better. 56, 40, 44. The minimum age for marriage now being 18 in 6 of our countries. And of course, we must mention we've got our Mozambique colleague on the line. Mozambique being the only SADC country that has used the SADC model law on child marriage to um, adopt its own national level law. So a very good example of how we can domesticate SADC, from the regional level international. Where are we doing very badly? Gender-based violence, intimate partner violence, maternal mortality, the decriminalization of abortion, the percentage of budgets. So these are still remain very low. And then the use of condoms at your last high risk sex, which it also shows. I think we can see the effects of all of this and how it's impacting on women and girls particularly. So as you can see, South Africa would expect would score very highly just in terms of some of these indicators. Mauritius, surprisingly, Mauritius was lower than South Africa, given that it has a small population. But then, if you look after that, I mean, all our countries are 33 and below, which is a very low level of performance in terms of those 12 indicators. And I think the challenge is how do those 12 indicators, those 20 SRHR indicators, also then find some voice in the RISDP? Because to have it just there and then we have another whole process and they're not talking to each other is highly problematic. And what it means is we tend to work in silos rather than look at a holistic way of achieving gender equality, particularly. So maternal health, menstrual health, big issue. 14 countries remain below the target, above the target of 70 deaths per 100,000 women. Only 6 countries, as at 2020, had removed VAT from menstrual hygiene products, and 5 provided free sanitary wear. We know this is becoming a very massive flashpoint for young girls, particularly in relation to school attendance. Now, COVID impacted massively on adolescent SRHR. I mean, 70% of kids were out of school due to COVID. And again, in South Africa, we're at that same point. There was a very interesting turnaround by the Tanzanian government, and it was interesting to note that that turnaround happened as a result of World Bank pressure, where they changed their position on teenage pregnancy and now allow young women who have been pregnant to return to the schooling system. 24% of all pregnancies in Southern Africa end in abortion, but with the exception of South Africa and Mozambique, every other country has some form of legal abortion with conditions, and it's not available on demand. And we know the Maputo Protocol, ICPD, all say that this should be a service that women and girls should be able to access. So there's certain places like Namibia, Botswana, and Lesotho where there's some momentum as non-state actors. We need to capitalize on that and push that it be decriminalized, and the reason for that are very clear. It's a basic human right to make decisions about your body. HIV and AIDS. Generally, new infections are declining, but increasing among young women. And COVID-19 could obviously impact. And the thing about COVID-19 is we just do not know. We do not know what the impact is yet. We're so busy dealing with the pandemic itself. We don't know what the consequences. I mean, there have been some interesting consequences. I know there are times when borders were closed and contraception couldn't get from the port of Beira in Mozambique to Malawi. And in that month where there was no contraception, they saw a massive increase in teenage pregnancy. So there's some very practical impacts, and then there are long-term consequences of that. Of course, what this, we don't even need to, the parallel pandemic, the 20% surge in GBV. Be interesting what our research will show for this year. And again, a very interesting trajectory is that SADC is working on a GBV strategy. And the question is, how do all of these things work together? We're talking about the GBV, about the shadow pandemic. I know SADC is in the process of working on a GBV model law, but how much of that has fed into the RISDP, for example? So the age of marriage still remains a flashpoint. We know that the age of marriage at 18 is only the beginning. I think Mozambique, the first country that recognized that beyond the age of marriage, we need to consider what happens to girls already in marriage. How do we help extricate them? And then if we do, how do we get, education, etc., etc. So it's more than just the age. And the age in some ways is easier to, and countries are saying, oh, well, we've changed the age of marriage to 18. But what about all those young women already in those marriages? How are we going to assist them? Sexual diversity, massive issue, particularly in the time of COVID, where we still have the decriminalization of homosexuality is one part of a very big picture. Because while Mozambique being a case in point, with the penal code review, homosexuality was decriminalized. However, there are no social protections. So Lambda, the LGBTI organization, still remains unregistered. So it's not just about decriminalization. Similarly, it's a similar situation with child marriage, safe abortion. Decriminalization is step one. But LGBTI people in most countries have no rights beyond that. So that, except of course with South Africa, where you can marry, can adopt children. There's a couple in Namibia desperately trying to adopt a child. So, these are things we have to focus on. So what gives us hope? I think what gives us hope is in between all of this, there's absolutely innovative, interesting work happening across the region where people are making important links. We run a program called the Sunrise Campaign, where we're making the link between the prevention of gender-based violence and economic power. Very important. We're looking at sharing of good practices, but also other people across the different countries. And I think the importance of knowing what these good practices are and how they're occurring is these are the things that provide us with some way of understanding what we need to be doing at national level in order to address some of the outcomes that we want in the RISDP. And more importantly, when you put the RISDP together with all of the other things that are happening within SADC, like GBV model laws, like the model law on child marriage, how we then make those things matter at a national level, how it starts to get rolled out and implemented. And obviously, ultimately, this has to happen within the framework of the SADC Protocol on Gender and Development. So I'm going to stop there for now. And perhaps, there is another presentation that I have that I'd like to do, but perhaps we could have a brief discussion. And the second presentation is around vaccine justice and COVID-19, because there's a lot of feminine issues around women's rights, feminism that are emerging around vaccine justice. But for the moment, we can stop and have a conversation about how these findings link to the RISDP and what are some of the things, what recommendations we can make about country level actions. Thank you. Please, we're a small group, so we won't stand on ceremony. Anybody who'd like to comment, please go ahead or ask a question.
Okay, I'd just like to let everyone know that we now have French and Portuguese interpretation. If you need to go into the channel, you can select at the bottom of your Zoom tools, and then you can choose the Portuguese or French channel. Thank you.
Hello? Everyone good? Anybody has anything? I mean, as you have listened and looked at that evidence, what are your thoughts about how, first, I think at the level of principle, how that kind of sort of evidence gathering research can strengthen the RISDP and its implementation at national level? And secondly, what are some of the things we need to encourage, we need to push at national level that governments do? Hello? Shami, do you think? I'm hoping everyone can hear us.
I think so. I don't know. Maybe we can just do a round robin and ask everyone.
Yeah, I think that's a good idea. So Chikondi, you joined us a bit late. So maybe introduce yourself. And I know you came in a bit late on the presentation, but anything you might have heard that has resonance and a resonance in, and I would say it's Zambia. Am I right?
Malawi. Hello.
Malawi.
So, hello everyone. Sorry, I did join a bit late. And I'm Chikondi Chavuta. I'm the Southern Africa Advocacy Advisor with CARE. I'm based in Lilongwe, but yeah, supporting countries within the region. So I don't have much to say because I'm trying to also catch up for joining late.
Okay, sure.
Sorry about that. Yeah, but if I
No
have
problem.
anything, I'll definitely raise it. Thank you.
Okay, great to have you. Delight, anything you noted that you think, is a priority that national governments and us who are the non-state actors should be pushing for?
Okay, thank you very much, Kubi. I hope I'm saying it right.
You are, that's great,
Yes.
thank you.
It was a very detailed presentation. I guess for me, it's more of a question from lessons learned on how Mozambique got to adapt the model law on child marriage and how that it's going for them.
Yeah.
So that probably as non-state actors within Zimbabwe and other countries in the region, we can also try and see how our governments can also adopt a similar approach, more or less a similar approach, given also that you've said a model law for GBV is also on the way.
On the cards, it's already.
Yes, on the cards, So that's a question I have. Thank you.
I think, Upendo, are you from Mozambique? You are, right? But perhaps I could start. I mean, one of the things that struck me as very important is we did a review. Okay, Upenda, would you like to go first? Please go ahead.
Yeah, all right. Of course, I joined a bit late. Hello? Yeah, of course, I joined a bit late, but what I can emphasize on it's with this COVID-19 pandemic, I think the government should mostly put some other emphasis on youth so that they can help in putting some other views in different projects so that maybe we can also take part because of this pandemic.
Thank you, Upendo. So
Sure.
what you're saying, Delight, is a very notion. In 2019, then again in 2019, Mozambique had, after 1886, they adopted their penal code. Then they had 2 reviews in very quick succession. And the reason why I'm raising that, a lot of what happened in Mozambique around the changes in laws, etc., stemmed from the review of the penal code. Because many of the things that we're talking about are actually criminalized in the penal code. Homosexuality, things around, say, abortion, age of marriage, rape, a lot of these things were actually in the penal code. And when they reviewed that, it opened the door to decriminalize homosexuality, for example, but it also then pushed for reviews of various laws. And I wonder, I always say to everyone, we do not pay enough attention to the penal codes. Because in how many countries, so for example, how many countries here on this call now, where things like, where the penal codes from way back and that criminalized various things are still in place and haven't had a review? So Delight, the answer to your question is a lot of what happened in Mozambique, because they decriminalized homosexuality, decriminalized abortion, put in place a standalone child marriage law. A lot of this happened as a result of that penal code review. Do you think that's an action we could recommend? I'm trying to remember who's from Mozambique on the call.
I think the Mozambique participant dropped. Yeah, I don't know if there's anyone else, but I know Sazi wanted to put her hand up.
Sazi, please go ahead.
Thank you so much, Kubi, for the presentation. I think it's good that the barometer is done every year and it guides our implementations. I hope I'm audible.
You are, thank you.
What caught me really is the issue of the many 24 pregnancies which end up in pregnancy. And a lot of them really are for the young people. And when I speak in terms of Zimbabwe, a lot of them actually are very unsafe and they are adding a lot to the high mortality, maternal mortality.
Yeah.
So it's really something I would really want us to push for, so that if it's legalized, then we are going to save the lives of these girls. And this is actually very much linked with the age at which these girls can get contraception without anybody judging them, without expecting parents to escort them because of their ages. So really, they are unintended and contraception is not available and the abortion is not legalized in many of our African countries. So I really think it's something which we need to push for. And the other thing which also caught me is the issue of menstrual hygiene. Yes, I know some countries, they've removed the VAT, but even after removing VAT, you'll be surprised. Our young girls, some of them are so much vulnerable. They can still not afford even after removing the VAT.
Yeah.
And hence, most of them are missing school. And once you miss school again, you end up in child marriage, you end up in this mortality we're talking about. I think it's just as good to a ripple effect, some of these things. Otherwise,
so it's a question, yeah. Anyone else? Anyone else like to comment on? Lawrence Lewis, where are you from, Lawrence?
Hi, Kobe. I'm working at the Embassy of Switzerland, based in Harare.
Yes.
So we support various programs in the region. And one of them is the Safeguard Young People program that has been helping countries in SADC in terms of domesticating that model law. And I was trying to look at my report in terms of the progress. I should recall that Malawi seemed to have done something within the region. I know there was
Malawi, they made you see that there's two things. Malawi actually changed the age of marriage to 18. Mauritius, Malawi, that's happening. But the issue is to go beyond that and to actually now to get model laws in place, get laws in place based on the SADC model law on child marriage.
And I know Zimbabwe, I think there was a constitutional judgment as well done in relation to
age of 18,
marriage.
yes.
Yeah. So, but the point which I had wanted to make is, we also get information from the SADC Barometer. It's a very useful tool for us to track the progress. And the issues which we had, or the concern that we had, was the lack of progress, or the going backwards in terms of economic empowerment, as well as political representation of women. Overall in the SADC region. I remember there was a high-level dialogue that was done by Zambia, I think a month ago, which really put those issues on the fore. So I'm not sure to what extent do you see those things as well? Because before the COVID, those indicators are also quite poor. But now there's a lot of intimidation, there are elections happening in the region, and the women, also we are retrogressing in terms of economic empowerment, as well as political representation. So I wasn't sure, because I didn't see that in the barometers, the timetable, the matrix that you presented. Is it something that you look at as well, or not?
Absolutely, it's a very big part of what we do, and it's just a lot. We do women's political participation is a massive part of our work, and in fact, when was the dialogue, Shami? On Monday?
On Monday, yes, on Monday.
We actually had a global dialogue on the representation of women in politics in Africa. We've just completed a barometer for the representation of women in politics in partnership with International IDEA. And we can certainly share those findings with you. I think part of what we were quite interested in is how this event coincided with the Paris Generation Equality events. It's actually happening at the exact same time. Yeah. So we did. And if you're interested, please get in touch with Shami. We're very happy to share that research. It is the representation of women is a key component in attaining gender equality. So yes. Definitely.
Thanks, yeah.
I think the purpose, the previous RISDP had a very strong focus on wellness, the wellness of SADC citizens. Now we're saying, in terms of what we'd like to recommend, I mean, what do people think about reviews of penal codes at national level? Raphael, where are you? Raphael, you want to tell us where you're from and maybe how you feel about the possibility of something like that? Raphael Mugomba. Not sure you can hear us. Ruth Salbrink from Action Aid.
Hi, good morning, everyone. My name is Rose. Thanks so much for calling me out. And apologies for joining a bit late. I was really interested to learn from you all. I've only recently joined my job at Action Aid. I was previously working with Womankind Worldwide, a women's rights organization in the UK. So I don't think I have anything to add on this specific question.
Sure.
But yeah, totally agree with the things that were said around the Generation Equality Forum and the importance of women's representation and political participation that were mentioned just now. But thank you, and yeah, happy to come in at a later point if helpful. But I think my background is a bit more international than country specific, if that makes sense.
Sure. Okay, look, I mean, if we, I don't want to force people into, I think part of what I'm struggling a little bit with as well, having looked at the RISDP is, Chikondi, please go ahead.
Yeah, sure. So I do agree on the penal code, and also at community level, the bylaw aspect, tends to really help. I think for us on the abortion bill, we were a bit disappointed with the outcome that came from Parliament on change, leaving it in the hands of parliamentarians who are biased in their views in a way.
Yes.
We ended up having the law not passed, and the issue is still not being addressed because we are still struggling with having autonomy controlled, women's autonomy being controlled by parliamentarians who are majority male and with biased with very biased opinions. So I would say at community level, we have seen some successes on having, set bylaws. Now this is on the early marriages aspect. The conversation on the abortion is yet to be taken down to the community, but that's something that, we really need to have the conversation on and, try to highlight why this is important for women and why we need it to be recognized and protect the girls. So that's what I would like to share for now. I'm yet to get like a picture from the regional aspect, but yeah, great to see the Barometer share that and learning from that. Thank you.
Yeah. Excellent. Anyone else who's interested in commenting? Because I do have, as I said, Shamin, I was splitting this section into two parts. This session, I think the first part will focus on the broader issues and then a very specific focus on vaccine justice, because I'm thinking any strategy in SADC right now needs to look at how we deal with, prevention and stopping COVID. South Africa is now officially in its third wave, and I can tell you it is bad. It is very bad what we're facing in South Africa right now. So we will look at that a little bit. Anyone else has a comment? And just a comment, Chikondi, on safe abortion. I've started thinking about it a little differently. And like all things, I think the way we approach it perhaps needs to be reviewed. As I was talking about the penal code, because in just to check, in most countries, there isn't a specific law that criminalizes abortion. It's included in penal codes and various other things. And my suggestion is the easier route might be to decriminalize rather than lobby for specific laws on safe abortion. Because in my view, safe abortion should be part of a health package, part of a human rights package. So the minute it's and that's what Mozambique did in as opposed to South Africa that has a whole law, which is great. But Mozambique just decriminalized it by removing it from the penal code as a crime. So then obviously it became a policy issue in terms of health and how they then start rolling it out. And I think it's something as a region we do need to discuss, and at national level, what the best approach might be. You know, something to think about. Anyone else? Raphael has sent us a comment in the chat. I think Raphael is agreeing with me. So is Chikondi. I think it's just coming after having worked in this area for so long and just understanding that perhaps, you know, it's very important to address the right problem. So if it's okay with everyone, should we look a little bit around COVID-19 and vaccine justice? Because I think it's an area that we're not even talking about and really is very, very important, because within vaccine the provision of vaccines, the gender dimensions that are emerging are quite frightening, actually. Is everyone okay? You can unmute and, you know, or put just thumbs up, tell me that it's okay to move to that area. Is that good? Great. I got 1 thumbs up, 2 thumbs up, yay. Great. And again, let us just sort out Zoom. And share. My screen, no, that's not what I want to see. While I'm doing this, can I get an indication from people on the call? Just what is the status of COVID now in the various countries and vaccine rollout? Shall we start with Zimbabwe? Which would be Delight, I think, or even what is the status of your rollout now? Hello?
Hi, Kubi. Okay, so I was just trying to bring up something the Ministry of Health circulates on Twitter every day. But let me just try and see. From my understanding, currently we are under 1 million fully vaccinated individuals. Then also we do have a few people who have had their first jab, but currently waiting to then get the second one. But I would say the rollout, mostly what we've seen, the government has said they've had a facility funds they've set aside from the budget to procure vaccines from China, but the ones that have currently been on use are the ones that have been donated from China and Russia. So when I get the numbers, I'll put them in the chat box. Yeah.
Excellent. And Malawi, Mozambique, any other country on Well, South Africa, you probably know, is terrible. And we're in a bad state. Any other? Malawi, Chikondi, how's it going?
Yeah, sure. So the numbers are slowly going up. As of yesterday, we have had about new 184 cases. Still low if you compare with the other countries within SADC, but it's slowly picking up. In terms of vaccinations, we have had only 385,000 out of a population of close to 17 million accessing the first dose, and only 43,000 people, about 43,165 have accessed the second dose.
Wow.
So there is definitely an issue of I myself have also been affected with, having no second dosage yet within the country. Within the past week, we have had over 65 new people being hospitalized. So there's like an increment of about 85.7% from last week. So it's really slowly peaking. And within the past week, we've had also about 3.3% overall fatality ratio. And yeah, I think the issue of vaccine access is becoming quite, it's personal, as much as it's a political issue, it's becoming quite personal now. And we are hoping that there is a solution in terms of how quick we access the second dosage, and for those that are also trying to get the first dose, it's access to them. We can also, give an update without, acknowledging the fact that there are also a majority of the population who are unwilling to get the vaccine due to other reasons. So there is also an issue of either lack of awareness or, there's still mystery around the vaccine. And now that we also don't have the second dosage in place, it's sort of also, taking us back on the vaccine awareness and vaccine acceptance campaign. So yeah.
Thank you. Let's put it in perspective, right? South Africa has reached up to 17,000 new cases a day. So we in big trouble. But anyway, look, on the subject of vaccine justice, let's talk about what that means. So what is vaccine justice? We've all heard the science where we've said that in order for us to get control of COVID, we need to have we need to have created immunity in 70% of our populations. None of us are anywhere near that, but it does mean, they call it herd immunity. So what is vaccine justice? I think it starts from the premise that it should be free. Nobody should have to pay for it. And even when it's available for free, South Africa being the case in point, I will choose to do it through my medical aid because it's quicker. So it's a catch-22. And I'm a family of 4, my husband, my son, my daughter, and myself, and 3 of us have already had COVID. My husband's father's died of COVID. So you're going to get the vaccine, very recently in May. So if you have an opportunity to get the vaccine, you're going to take it whichever way you can. The other issue is unequal access is going to create long-term consequences. And my fear in SADC and other parts of the world are starting to wake up to this, is if we don't start thinking this through carefully, the long-term consequences are all the gains we've made are going to start reversing. And it's very important for us to keep focusing on how we create equitable distribution of vaccines and free distribution. So, the next slide, which is, there we go. So let's look at how it's going so far. And people are starting to talk about vaccine apartheid, where, you know, most of the vaccines, as we know, is sitting in the north. Some of them have much more than they need, but still hasn't filtered down to any other parts of the world. So 20.9% of the population, world's population, has received 1 dose, and 7%, so 1/10 of what we need to be, you know, we need 70, need to be fully vaccinated. We need to keep going, but now here's the problem. Only 0.8% of those people in low-income countries have received 1 dose. Africa, again, remains one of the most unvaccinated continents, with less than 1% of the population fully vaccinated. The long-term impact of that is we're not going to get this under control anytime soon. We're going to go into the 3rd, the 4th, the 5th wave because we just do not have enough immunity. You know, look at North America after Biden and Harris have come in, are looking at 40%, 41% of the population being fully vaccinated, and 28% in Europe, in the EU. Now, South Africa, as you know, at the moment is with the highest levels. And South Africa has 0.81% of its population vaccinated, which is going to be a massive issue for us. Why is it a women's rights issue? COVID, one has to think back to ARVs and its distribution and how it affected women and men when we first started. Now it's going to be a similar issue. If there are going to be choices to be made about who gets vaccinated, most often it'll be the male. And, you know, women still have, the burden of care is increasing because people are ill and somebody has to look after them. What we don't have is sex disaggregated data. I mean, we should have learned by now that every single thing we do, we need sex disaggregated data because men and women and other sexes are affected differently. You know, and sexual orientations. I mean, we have no idea how, we know that COVID has impacted on the LGBTI community in a very negative way. We just have very little data on that. So what we have sex disaggregated data on who's died and perhaps who's got, who's received vaccinations, but we don't know what issues have occurred. We also know that in South Africa, for example, while fewer women are dying, but more women are getting infected. So we're not entirely sure why that is. We also know that violence has become a massive issue as a result of COVID-19. There's economic stress, lack of access to basic healthcare, like primary healthcare. So, you know, lack of access to contraception, antenatal, postnatal care. So maternal mortality will definitely be affected. We also need to know what the side effects of the vaccination are. How is it affecting, there we go. How is it affecting women? Because some people say they have heavy menstrual flows afterwards. You know, we don't know. And the problem is we're going to find this out long after we've done the vaccine rollout, and then we're living with the consequences. Again, the question around decision-making. Of course, women comprise 70% of the global health workforce, but only have 25% in leadership positions. Again, an issue. we need to be very clear about how that vaccine rollout processes must not replicate the gender inequalities existing in society right now. Now, important issues to consider: access. Where are the vaccines available? Urban, rural divide becomes very, very important. Now, in many countries, South Africa, I don't know how it's happening in others. In South Africa, you have to register via an online system. And, you know, the digital divide becomes a massive issue. If you're unable to get online, don't have a smartphone, don't have internet, how do you register? The other issue, it's a massive issue, is women, all the research has shown, has limited decision-making power in health-seeking behavior. So who's deciding who gets vaccines in the household? The other issue is documentation. In most of our countries, you require some form of ID, some form of identification. This affects migrant women, migrant people. It affects people who, you know, older people who don't have identity documentations. And then, of course, the massive issue around safety. You know, how are women, if they're in abusive relationships, how are they going to go get this vaccine? What are the safety concerns? So most, you know, 79% of reports are showing that women who've received Pfizer and Moderna experience some kind of side effect, as opposed to men. Again, we do not know, you know, age groups, sex, what are the side effects? We need that data. And, you know, the side effects are serious. We need to understand. There was a time when we were issuing something called Depo-Provera for contraception, and we only discovered much later that it led to long-term infertility. So the bottom line is there a clear rollout plan that is fair, equitable, and timely? You know, how are we deciding? South Africa's got this odd situation where we're doing it by age. But at the same time, the contradiction there is so many of the older women in rural areas looking after families as a result of things like HIV, etc., don't have access to internet to go register. So who's actually looking out and making sure that that occurs? And we need to look at, you know, when we're looking at success in vaccine rollout, it's not about how much, it's about who. Who's been vaccinated? I have the most vulnerable being vaccinated. And now we're seeing in South Africa with this new variant, the Delta variant, the third wave, children are suddenly becoming more vulnerable to it. And, you know, no one, the herd immunity, the only way we're going to get this under control is if we have critical mass, where everyone is safe. So we have, this is so far what we've been doing around vaccine justice. And Genderlinks runs a program with the local community-based organizations that we work with, and we doing small grants from the Canadian government. It's called Women, Voice and Leadership. And part of what we're doing now is the vaccine justice rollout. Because as you said, Chikondi, one of the other massive issues is education. People are very afraid to take the vaccine. You know, so these are some of the issues that are emerging. I think it's very important to talk through the gender dimensions of vaccine rollout. Any questions, comments, anything you feel you can add? It would be very interesting to hear from other countries around how this is being handled and the gender dimensions of it. Hi.
Sorry, I have no access to raising my hand. Sorry. Thank you so much for this very informative presentation. I'll be talking on behalf of Zimbabwe because that's where I have experience. And I think the last thing you talked about the education. Because what I find in our communities, especially those who are vulnerable in the communities, there is not enough information. When this vaccination started, people developed the cold feet with so many fears. And therefore, this is why people didn't even take it. Initially, people were being begged from their houses to come for the vaccinations. But now we've run short when people have just started understanding. But I still feel the most vulnerable in the communities, they do not have enough information to really unlock their fears. And also, I think social media is also not doing justice to the information which you are getting, because there's a lot of conflicting information about especially the long-term side effects of the vaccines and all that. Even those people who would have decided to go for the vaccine tomorrow, but when they get this information from social media, it reverses their thinking and they again develop cold feet and may postpone actually getting a vaccine. And this definitely has got an implication in terms of the herd immunity, which you're talking about, which can actually assure us about being protected as a nation or globally.
As a region, yeah.
Otherwise, thank you and over.
Thank you, Stasi. Anyone else? Any observations from any other countries? Has there been any work done in any other countries around the gender dimensions of access, of decision-making? Rachel, you just joined us. Where are you from?
Hi. I'm from Zimbabwe.
Good representations.
Yeah, organizationally, I'm from the Public Service Accountability Monitor, who's a member of the PSA Alliance. So I just wanted to contribute that in terms of like vaccine hesitancy, one of the biggest contributors I feel is the lack of comprehensive, or rather a comprehensive or a systematic, consistent communication strategy from those in authority. Because if you find like in Zimbabwe right now, a lot of announcements are made in different places, and then there's a lot of confusion around. So maybe if communication was at least, there was consistency in messaging, that would be one of the ways in which information could cascade in a much clearer way. And then the other thing that I wanted to highlight in terms of, I just joined late, but there's been research done by Amref Health, Amref Health University on vaccine hesitancy, or rather the gender dimensions of how the misinformation is contributing to vaccine hesitancy in Kenya. And I think I can share the links to that research. I can just put them in the chat. And also some information around the economic preparedness and the economic preparedness of specific countries in Africa. But the findings can be generalizable, and how the financing aspect also has gender dimensions. So I can share that research now, actually.
That would be brilliant. Thank you so much.
Sure.
This would be very helpful. Anyone who has any kind of resources, we would be very happy to receive them. Anyone else? Lawrence, also Zimhe.
I think, my colleagues have, from Zimbabwe have pointed out the issues that we have here. I also working for a government agency. I wouldn't be the right ambassador for the government of Zimbabwe. But we also take note of those reports that are being spoken of. I know the Ministry of Health, they do send communication, and I think on the chat, one of the persons from Zimbabwe actually gave us statistics that we received from the ministry, and Rachel also spoke about that report. And there's another one that was done by UNICEF as well on vaccine hesitancy in June as well. So those are some of the issues which are in the context. It's not only the availability, but also the hesitancy for those who are within the context. Yeah, thanks.
Shami, you've just written this chapter on the ASR-HR. What did you pick up in relation to COVID and vaccine justice, etc., in your chapter?
Well, I guess the thing that relates to the young people is that a lot of the trials haven't really been focused on 16 years and under. Most of the trials have been 16 years going up. And then the few, if I'm not mistaken, I think Pfizer is the one that did do trials for under 16. So in terms of recommendations, in terms of parents wanting to vaccinate children that are under 16, I think Pfizer is the only one that has done trials in terms of just under 16, because they're, the discussion has been that adolescents and young people are not necessarily prone to, COVID in a way that it would really affect them. So, but it's changing now with the different waves. So I'm still, yeah. So that's the big part too. The question is, what happens to adolescents and young people? Do they now need the vaccine or not? So I think that's research that's going on now.
Apologies, I didn't realize I was muted.
Oh. Yeah, so, yep, not much for the young people.
Anyone else? I mean, I don't want to drag this out longer than it needs to be.
Yeah, just
Chikondi, please go ahead.
Sure. I think the issue, you touched on it, the issue of the media. There hasn't been a lot of responsible media and reporting on the issue, and also trying to demystify issues of even just sharing issues of vaccine justice in general. So it's an area that we also need to see on the advocacy component. How do we really share this? How do we make this as, the information sharing aspect using the existing media, also outside social media? Thank you.
Thank you, Chikondi. Anyone else? So perhaps, we can aim to finish at 11. I think we can all do with the extra time to do our other work, but some concrete recommendations. I think the first one was a review of penal codes at national level. I think, now to around COVID and vaccine justice, just around the notion of gender disaggregated data, very important information around ensuring that there are some clear communication plans happening and to address vaccine hesitancy. Again, in terms of gender as a cross-cutting issue, I think we did say something around gender-based violence and economic power, but also I think overall we've said things around all the different SADC initiatives speaking to each other and being integrated. So the RISDP must take into account the SADC protocol on gender and development, the model law on gender-based violence, because I see it is a cross-cutting issue. Issues around, for example, the SADC model law on child marriage. So, these things should not be occurring in silos, but should talk to each other and build each other. I don't know if anyone else would like to add. Is that good? Can we, Shamik, is that what we can send then?
That's the recommendations.
Yeah, Secretariat. Is everyone good with that?
There's a comment in the chat. Okay,
thanks so Lawrence much. Is good, Chikondi is good. Okay, so we were a much smaller group, which is why we took a lot shorter time, which is not a bad thing.
Yes.
So yes, I think to say thank you to everyone for joining us. It was interesting. I think we've got an indication. Maybe we could just ask everyone, Shami, to please put their names, organizations, and contact details in the chat.
Oh, yes.
So we can also copy you what we send. Is that okay with everyone? Just in the chat, put your name. Rachel, you want the 2 presentations. Is that what you're looking for?
She did, yeah, so she mentioned of a certain study that was done. If she can share that box,
yes,
yeah.
no, definitely. I have 2 very good papers that look at fiscal norms around the vaccine issue, vaccine equity, and then also norms and attitudes and how these are fueling vaccine hesitancy.
Excellent. Can we maybe, Shami, put your email also so we can get everything?
Okay.
And then we can upload it.
Yeah, no, definitely. I think, yeah, because I'm having trouble trying to upload them via Zoom.
Yeah,
So
I
if I
think
can get like, yeah.
I've seen Shami put her email in the chat, but perhaps all of you could just put your names, organizations, and email addresses, so then we could just have a record of everyone who attended the session.
Thank you. Yes,
please. There, I see Rose has. Okay, I'm just going to mute myself, Shami. If you need me, just let me know.
Okay, thank you.
Thank you, everyone.
Thank you, Kubi. Everyone, I'm just waiting for everyone to type it. Okay, Chikondi, thank you. Thank you. I'm seeing all the email addresses. Thank you. Thank you. And to the interpreters, thank you as well for being on the session. Okay. Okay, Rachel, can you also share your email address on the chat so that I can just share with everyone? Oh, there, I see your email address. Sorry, I hadn't seen it.
Yes,
Okay.
I did. So where do I send the reports? Do you want me to send them to you so to circulate, or I can just take down everyone's email address and just send one email?
Because I'll get all the emails from the chats. So you can send to me, then I'll circulate as one email.
And your email is?
It's alliance@genderlinks.
Oh, yes. Okay, I had taken that one down. Okay.
Okay. Oh, okay. If you've taken that.
Okay,
I think I have
sending it shortly.
Okay, thank you. Thank you, everyone. I think I have all the email addresses. So when I send the recommendations to the Secretariat, I'll include everyone. Delight, do I have your email? I'm just trying to make sure before I close the meeting. Okay, I don't have Delight's email.
Hi, Shami. Let me share again. It went to a direct message to Sazi.
Oh, okay.
Sorry about that.
All right, okay. I hadn't seen it.
Okay, there we go.
Okay. All right. I think that covers everybody. So thank you for a great meeting to everyone. I will close this one off. I'm not sure if you're all going to join the 2 o'clock. I think that's the next session. And I think you should have the links to that next meeting, if I'm not sure. Yeah, let me see what time it is. Oh, no, not 2 o'clock. It actually starts at 4, the afternoon session, which is the way forward. So thank you. Have a good day. Have a good rest of the day. All right, then. Bye.
Bye-bye.
Thanks and bye-bye.
Thank you.
Thank you. Bye.
Bye. Goodbye.